The broadcast is now starting. All attendees are in listen-only mode.
This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wiseye.org.
In their communities. So 2 regional drug positions were created by legislation in 2017. One of those prosecutors is based in Appleton. The other one is based in Wausau. We also have a third regional drug prosecutor using existing DOJ resources, and that third prosecutor is based in Eau Claire. These prosecutors have helped make a difference as we work to fight the drug epidemic in Wisconsin in a few different ways. As our report that we sent to the legislature recently, which you should have a copy of, details, these prosecutors help in by doing a few different things. One is they can work with investigators as significant investigations are ongoing. And our regional drug prosecutors are located out of our regional DCI offices. Those drug investigations that the Division of Criminal Investigation does are often significant ones that focus on large-scale traffickers. So the regional prosecutors are embedded with those investigators, can provide consultation as those investigations are ongoing, and they can also work with DAs in nearby counties as those investigations develop, so that our drug investigations are not just targeting folks who are the lowest level drug dealers, but instead can work their way up the chain and target high-level drug traffickers, and we can work to dismantle drug trafficking organizations. Another important role that our regional drug prosecutors play is prosecuting Len-bias homicide cases. Those are reckless homicide cases where somebody's involvement in the distribution of drugs results in an overdose death. Those are very difficult, challenging cases. They're ones that obviously have an enormous impact on the family members of the victims, and prosecuting those cases is one of our priorities as well. The report that you have summarizes some statistics from the work that our regional drug prosecutors have done. And as you can see, they work on cases not only involving large-scale drug trafficking, but cases involving some of the most dangerous drugs that our communities are faced with, including fentanyl, heroin, and meth. So today you're going to be hearing from 2 DAs who've had the opportunity to work with our regional drug prosecutors. They'll provide a little bit of feedback on what work has happened with those prosecutors. And then the 3 of us will be available for questions. So first, let me turn it over to Polk County District Attorney Jeff Kemp.
Thank you, Josh. Hi, I'm up in Polk County, which is about an hour's drive northeast of the Twin Cities. We're right on the border of Minnesota along the St. Croix River. Methamphetamine is our problem. Quite honestly, we don't see a whole lot of opioid abuse. There's some here, but meth is still king here. It has been for probably going on the last 20 years to the point where we have 3 generations of people whose lives have been destroyed and continue to be destroyed by methamphetamine. I think I may have been one of I was on, as far as getting a special prosecutor, once this program was developed, I jumped on it right away because we have a caseload that would support 5 full-time prosecutors. At the time a couple of years ago, I had only 3. And so I looked at it as just an additional resource to use. I've been fortunate to work with Chad Verbaten, who's out of the Eau Claire office. And the cases that he typically prosecutes for me are their larger amounts of methamphetamine. It used to be we would see small amounts that came in, mostly for personal use, particularly in the beginning, when people were making it on their own. Unfortunately, being as close as we are to the Twin Cities, there's a direct pipeline from the cartels up to Minneapolis. and it's pure and it's cheap. And I don't know if anybody has seen the series Breaking Bad, but it's a pretty accurate representation of how the network, cartels networks work. As such, we have people that just drive down, grab a bunch, come back up, and we're starting to see larger amounts than we had in the past. In fact, 30 grams used to be a huge amount. Now it's kind of run of the mill. We're seeing amounts of 60, 90, 120. I've got one case that Chad's working on that, let me think, I think it's 284 grams of methamphetamine, which is a tremendous amount considering that for personal use, a user can get by on 1 gram for, several days to a week high. So I feel very fortunate to have this program at my disposal. It frees us up to do some of the other things that a poor rural county, frankly, has to deal with. Thank you.
Thank you, Jeff. We're also joined today by Outagamie County DA Mindy Temples. So Mindy, any thoughts that you have on the program?
Yeah, I'd echo some of what Jeff said. It used to be 3 to 5 years ago, if we saw an ounce of meth, that was a lot of meth. And now we're looking at half pounds or full pounds in the valley. And it's really changing the dynamic of our drug problem that we have. The other problem we're seeing is a big increase in fentanyl. We're also seeing heroin that's cut with fentanyl. And so when we're getting our toxicology back, the toxicology results are much different than they used to be. And so having somebody who is really knowledgeable in both drug sales, the drug trafficking industry, and the science behind it is really important. And what we have found is the Assistant Attorney General in our area, Pete Hahn, has been a wealth of information. He is a great resource for our local prosecutors. So even when DOJ is not assisting on a case, but we have questions about a case, he is always available to answer questions for our prosecutors. In most counties around the state, we have significant turnover, and so a lot of our prosecutors are younger or newer, or don't always have the expertise that the drug prosecutors through this program have. So that has really been a huge help. What we've also found really beneficial is that by involving the Assistant Attorney General in our area early on in the investigation, it's really helping us make sure we're training local law enforcement to do things the best possible way. And I think that that's really helped our investigation, especially when you have some of the smaller jurisdictions. It's also helped to bring DCI in because of the connection with the Assistant Attorney General in our area. So it's really improved the investigations that we've seen. And it allows us to work up the chain, not just to the low-level user, but to really work through the chain to get to the dealers that are really bringing the quantity of drugs into our area. As we have been seeing around the state of Wisconsin, and certainly the Fox Valley is no different, we have had a really significant increase in overdoses, and they are very tragic. They hit all parts of our community at all socioeconomic levels, all races, all genders. It really touches everybody. And the impact that it's having on our community is extremely significant. So when we look at trying to work up the chain in order to combat the drug trafficking, this has been one very instrumental way that has helped improve the way we respond. In addition, they also are assisting our office with prosecutions. So they come on board and help other prosecutors. These are very time-intensive cases. They're very complex litigation cases. In many instances, there's a lot of data and access or warrants that we've done accessing different forms of technology that really have to be boiled down and reviewed. And it's extremely time-consuming. And it's hard for DA's offices around the state. As DA Kemp said, in Polk County, they are short prosecutors. Outagamie is no different, as are many of the rest of the counties in the state of Wisconsin. So by having a drug resource prosecutor, that is just one more tool in our tool belt to ensure that we are trying to address the significant drug issues in our community that is leading to significant addiction issues, as well as overdoses and deaths. And I have to say that it has been an extremely positive program. I think the regionalization aspect of it has been extremely beneficial to the communities and to our county specifically. It is a much different access than when we are working with an assistant AG in Dane County, but having somebody who is in our region really allows them to be able to build relationships with law enforcement, allows them to build relationships with prosecutors and other criminal justice partners to really drill down and try to address the issue. So we have been extremely pleased with the program and have nothing but great things to say about the work that Assistant Attorney General Hahn has done in our area.
Great. Well, thank you both for those summaries of the impact that the program has had. We'll open this up for questions in just a minute. I just wanted to emphasize a couple points that I think you've heard from each of us in one way or another. One thing that is really valuable about this program is it enhances coordination between different levels of prosecutors, the assistant AGs who are the regional prosecutors, as well as the DA's offices, and also cooperation between prosecutors and law enforcement, whether it's DCI or local law enforcement. And that kind of cooperation helps us take on large-scale drug trafficking operations as we need to do. And the second thing I wanted to emphasize is you heard from the two DAs about really what are the biggest drug challenges we face. The opioid epidemic has really shifted so that fentanyl and heroin and other illegal opioids are playing an enormous role in overdose deaths right now, and continuing to work to dismantle organizations that traffic those drugs is critical. And in a lot of the state, meth remains the biggest challenge that people face, particularly northern and western Wisconsin, but it's also impacting other parts of the state as well. And so continuing to focus on those two aspects of the drug epidemic is going to be critical going forward. So hopefully we will see continued support for this program from the legislature, and it will continue to be a success for communities across the state of Wisconsin. So with that, we'll open it up for any questions.
All right. If you can please raise your hand using the raise hand function or typing a question in the question form, we can start taking questions. Looks like we've got Brittany Schmidt. You should be unmuted, or you're good to go. Brittany, we can't hear you. You might be muted on your end. There we go.
Okay. Sorry. So we've been following, when this was passed in 2017 with the Hope Bills, WBAY in Green Bay has been following this. I know that you had to fight hard to get the money, the financials behind this to get these two assisted people. Wondering, it's supposed to end in 2023. Is there hopes to add more in the future or prolong, what's happening now? Because it looks like it's successful.
Yeah, this is one thing I'll emphasize. It relates to these prosecutors working together. This is really a program that has broad bipartisan support. When my predecessor, A.G. Schimmel, was in office, that's when this program was initiated. It's one that we have continued to support as I've been in office. And DAs from counties that are near where these regional prosecutors are based have been fully supportive of the program. We are going to need more funding to continue the program because there was a limited grant period for two of these positions. And we are going to be asking the legislature to continue supporting the program going forward. As I mentioned, for one of the positions, we're using existing DOJ resources. But both what we've heard from DAs and law enforcement around the state and in seeing the results, it's clear that this is having a positive impact. And there has been a lot of support for these kind of initiatives to fight the opioid epidemic and other drug trafficking in the legislature. So I hope that we will continue to see that kind of support, and we will be asking for that continued support.
Excellent. It does not appear as though we have any additional questions on this topic. We do have one off-topic question that Todd Richmond wrote. AG Kaul, any thoughts on the president and other prominent Republicans testing positive for COVID-19?
Well, I'll just say this disease has had an enormous impact on people across the country, including here in Wisconsin. And right now, Wisconsin is really the epicenter of the coronavirus pandemic in the United States. And so I want to just encourage everybody who is watching to take the kind of precautions that we need to stay safe. In parts of the state, including in the Fox Valley, healthcare capacity is being stretched to its limit right now, and medical professionals and first responders and others are putting themselves in harm's way to help people who are struggling with the virus and struggling and need first response in other ways. And everything that we can do to practice safe habits like washing our hands, social distancing, wearing a mask, staying home when you can, that's going to help protect our first responders or medical professionals. It's going to help protect the health and safety of your friends and neighbors, and it's going to help protect your own health and safety. And so I'm hopeful that we will see people continue to step up and take the kind of steps that they need to.
Thank you. It does not appear as though we have any additional questions. Now's the time, folks. Otherwise, we'll wrap this up early. Brittany, you should be able to, you are unmuted. Go right ahead.
Okay. Going back to, so 2019, we saw that these assisted attorneys general assisted in 68 cases prosecuting them. Without their help, do you think that these cases would have been prosecuted or just taken longer to do, or your opinion?
Yeah, I'll turn that one over to the DAs and get their take on it.
I think, go ahead. You go ahead, Mindy.
Oh, that's okay. I think in all of those cases, those are very significant cases. They certainly would have been prosecuted. However, there likely would have been delays. There are backlogs in most of our offices just because of the quantity of cases we currently have pending, as well as the shortage that we have of prosecutors. So it probably would have taken longer, but I think that they certainly would have ultimately been done, but I really think that the collaboration between the Department of Justice, between our offices and law enforcement is really helping us drive down to get to the bottom of things. And hopefully by the prosecutions, we have prevented other deaths and other addiction problems from people by taking some of those high-level drug dealers out of the system and addressing them through holding them accountable and hopefully keeping other people safe. So while I certainly think that it would have, they would have been prosecuted, I think it would have taken probably longer to get through the prosecution. And I think the bottom line is by being able to respond more quickly and collaboratively, I think we're able to keep people safe and hopefully keep people alive.
Yeah, I would agree with that. I would also add that if not for having the special meth prosecutors on some of these bigger cases, it takes away from some of the resources we have to devote to our other cases, particularly the drug cases. There's a feeling in my area, I'm certain that most other DAs share this, that people that are addicted to drugs are in a separate class than the people that are making money and actually bringing this poison into the system. So what we try to do through a variety of programs like treatment courts and diversion programs is to get people who need the help and the treatment, get them the treatment. As far as the dealers, we want them in prison. We want them out of the community to try to help some of these other people get a leg up, basically. And so it's been helpful in that way as well.
And I think to piggyback on what you said, DA Kemp, is that when we're talking about it likely also slowing our response to other drug crimes, I think an important thing to recognize is for those people that were prosecuting that are being prosecuted with possession or maybe more simple lower level sales. One of the challenges that we're also faced is that many people say that drug crime is a victimless crime. And I think what we see with the boots on the ground is that is not the case, because these people are certainly people who are in need of help and support and counseling and drug treatment, but they also have families. And there is a significant impact in our community for the kids who are being placed in out of care, placed out of home in foster care, because their parents are not in a position to be able to care for them because of their addiction issues. So there are a lot of secondary impacts that, while secondary, are really significant concerns in our community. And so if we can't focus collectively on all of these cases, we're really missing really important consequences in our community. So I think what you said is certainly appropriate. We have a drug treatment court in our community too, as well as mental health court. A lot of times we see those two intersect. But the drug issues that we're seeing have really real world impacts on our kids and our families and our community. And I think that by having, again, this other tool in our tool belt, by having the assistance of an assistant attorney general, it allows us to be able to really focus in on the problems and try to fix them the best that we can through the collaboration.
Yeah, and the one other thing I was going to add is, I spent part of my career as a federal prosecutor in a narcotics section, and whether in the context of seeing these cases or my own personal experience, drug cases, the traffickers don't work in just one county or one city. Their work crosses jurisdictional boundaries, and you heard DA Kemp mention meth coming from the Twin Cities, for example. One of the benefits of these regional prosecutors is that they can focus on cases that cross those jurisdictional boundaries. And while you certainly have that in cases handled a different way, the DAs are obviously immediately responsible to the people in their counties, and they've got limited resources. Having somebody who can help bridge those jurisdictional divides and make sure the cases are being investigated, even if they impact multiple different communities, that they're being investigated fully and to their conclusion, helps streamline that process and helps DAs conserve their resources for the communities where they work.
I think that's a great point and something we've definitely experienced in the Fox Valley, because I know Assistant Attorney General Hahn has helped us address issues. If you look at the city of Appleton, it's by and large in Outagamie County, but it is also partly in Calumet County and also partly in Winnebago County. So those multi-jurisdictional cases that we see are certainly prevalent in the drug community. I think that's a really important point to make, especially because we connect into Brown and we share a lot of jurisdictional lines. So that really assists us a lot.
Absolutely. County to county here too. Polk County is bordered by Barron County and Burnett County, St. Croix County, and I can't tell you how many times we have defendants dealing drugs that have pending cases in multiple jurisdictions like that. And it's certainly helpful to have one prosecutor who's familiar with the defendant and all of the cases handling that. I think it streamlines it, and I think you get better results. And quite honestly, I think it probably makes things move a little bit faster through the court system than having, 3 different prosecutors prosecuting the same defendant. It's sort of like too many cooks in the kitchen.
All right. We have an additional question from Emily Thornton. You have been unmuted, Emily.
Can you hear me?
Yep.
I believe I'm unmuted. Just a quick follow-up question, Attorney General, to the COVID question. Thank you for kind of talking about that overall, but any additional comments that you want to make about the challenge to Governor Evers' mask mandate at this point?
Well, that case is being heard in court today, so obviously we'll be following the developments there, and we'll have more to say after there's a ruling. Speaking just for myself here, I think it's vital that that mask mandate remain in place because, as I said before, Wisconsin is really the epicenter of the outbreak right now in the country, and any simple steps that we can take to reduce the spread of the virus are going to help save lives. They're also going to help our economy rebound sooner, because the more we can suppress virus cases, the more we can fully reopen our economy and help people get back to work. So I hope to see the governor's emergency authority upheld, and I hope to see people continue to take those critical precautionary steps.
Thank you all.
Hey, Jillian, if you're on, you're muted right now. We can't hear you.
All right, I've been talking for quite a while here. Thank you, Emily. We don't have any additional questions at this time, so feel free to raise your hand or post a question in the questions box now. All right. Well, if anybody has any questions, feel free to shoot me an email or email the communications office at the Department of Justice. Thank you so much for joining us, and have a great day.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.